Whatever happened to journalism? There was a very frustrating interview with President-elect Donald Trump by Meet the Press, and I'm not sure why these journalists don't ask follow-up questions, but we're going to talk about that today. I'm going to show you a little clip on it, and let you all rate the interview, whether you believe the interviewee should get or the interviewer should get an F or an A plus. When I first saw this, I almost broke my TV throwing stuff at it, and I'm like, why didn't you follow up? So I'm like, you get an F. But then I thought, well, her corporate overlords probably gave her an A plus because she did a phenomenal job. But I think me and the rest of y'all would probably say she got an F in her interview of the president elect. For the people that own, I guess, Meet the Press and NBC or Comcast, I think it owns, probably they get an A plus. But let's talk about that today. If you're new to my channel, my name is Ed Weir. I ran the third busiest Social Security office in the country, and now in my semi retirement, I help y'all make sure you get everything you're entitled to, everything you earn from Social Security, retirement benefits, disabilities, Medicare, survivor benefits, and this is also a live Q&A. So I'm going to talk about the disastrous interview for about 5 or 10 minutes. And then I'll answer some questions for the rest of the hour. So if you have any questions, let's make sure you're getting everything you're entitled to, everything you earn from Social Security from here and into the future. Okay, let's go ahead and join it. And let me show you the little clip on specifically Social Security and Medicare. The interview itself lasted about an hour or so, but there was, considering Medicare, Social Security affects 70 plus million Americans. I'm not sure why they didn't spend more than 26 seconds on Social Security. It's just, yeah, it's completely frustrating.
Which
all right, so here we
cuts
go.
to the federal government.
So first thing she starts off with is let me set this up a little bit. She talks about the Department of Government Efficiency, not truly a department. Congress didn't set it up, but DOGE, that's the one Elon Musk and them are going to go in there and supposedly cut $2 trillion from the budget to save, taxpayer money. Great, awesome. But the question is, okay, $2 trillion, the what you really have to focus on is where most of the money goes: Department of Defense, Social Security, and Medicare. So she asks about that, and here's what we get. Not much of a follow-up, not much of a response.
To the federal government. I think a lot of people hear that and they get concerned about Medicare and Social Security and
not
Medicaid
have anything to do.
and defense spending.
You
won't touch
theft,
Medicare, Social Security.
Abuse, fraud. Okay. No, I said to people, we're not touching Social Security, other than we make it more efficient, but the people are going to get what they're getting.
Okay, so the entitlements
and
off the table.
And we're not raising ages or any of that stuff.
Okay, off the table.
I won't do it.
And she has kind of a nice little, oh, look, I caught him, and I, made sure he confirms that he's not, not to kind of cut Social Security.
Proposes cuts to the federal government.
So
I think a lot of people hear that.
So again,
and they
proposes
get concerned
cuts.
About Medicare and Social Security.
They're worried about Social Security, Medicare, and he says, okay, we're not going to do it. We're going to focus on inefficiencies. We're going to talk about fraud, waste, and abuse, and I'll talk about that here in a little bit.
You won't touch Medicare, Social Security.
Okay. We're not going to touch it. And this is where I threw something at the TV. She immediately turns a page and goes on to a different subject. Where's the follow-up? Because here's the situation. For viewers of my channel, you know that as of right now, if we don't do anything, here's what's going to happen. If I put the report by the Social Security Trustees report in the description, so you can check for yourself. As of right now, today, if we don't do anything, Social Security checks are going to be cut by 21% in 2034 if nothing is done. If the next president passes some of the legislation that he wants to pass, then it's going to be cut sooner, and it's going to be cut more by 33%. So we have to choose. We have to vote what we want to do. Do we want to cut those benefits by 21% or 33%, or do we want to actually fix it? And here's the issue. Here's what's been happening for the longest time. Let me get my face out of the way here. So here's the strategy to essentially end Social Security. Like I'll call it ignore, distract, and privatize. So you ignore the problem, that there is a problem. Here's what she should have done. She said, okay, um, you're not gonna hurt Social Security anymore. And he says, no, I'm not gonna hurt anymore. And he says, I'm not gonna raise the retirement age, no cuts. People that get their benefits are gonna get their benefits. But here's a good analogy. Let's say these two are walking down the street and they see this guy has been beat up. He's bloodied, broken bones, laying in the alley, looks like he's about to die. And then she turns to him and says, are you going to beat him up anymore? You going to punch him? You going to kick him? No, I'm not going to beat this poor guy up anymore. And she says, okay, all right, well, fine, let's go. Let's go get a beer. That's it. That's it. The question should follow up and say, this guy's about to die. The next question is, okay, this person is, beaten up and bloodied in the middle of an alley. What are you going to do? Are you going to call 911? Are you going to go over there and help him? Are you going to go over there and give him CPR or stop the bleeding? That should have been the follow-up rather than, are you going to beat him up anymore? Nope, not going to beat him up anymore. Okay, all right, well, let's call it a day. Social Security is essentially bleeding right now, and they're ignoring the problems. And they're ignoring the solutions. And the solutions was raising the retirement age, cut benefits, but there's many more solutions. If you read in the description, one of the solutions is that I advocate is to end the cap on Social Security. Right now, if you make under $176,100 for next year, 2025, then you pay 6.2%. From your check goes into Social Security, FICA, Social Security. The other part is Medicare. But FICA, Social Security is 6.2%. And then your employer pays the other 6.2%. So for everybody out there that makes under $176,100, you pay FICA on every dollar you make. If you make over $176,100, you don't pay Social Security FICA tax anymore. Right? So someone that makes $50,000, they're paying 6.2 plus their employer is taking 6.2, so 12.4. If you make $5 million, you just pay for the first $176,000. So you're paying your FICA, what you're paying is 0.44%. I rounded it up a little bit, 0.43%. So if we get rid of that cap, as you can see in the description below, I put the Social Security, the chief actuary ran the numbers, and he said, if we get rid of the cap, that's 73% of the fix right there. That's it. And one of the ways of the distractions is, they distract people by saying, well, there's no perfect solution. If we do this, you're sure it won't help. It won't make it 100% perfect. Ed won't get his hair back. And so if it's not a perfect solution, then we're not going to do it. So, the perfect becomes the enemy of the good. So ignore the problems, ignore the solutions that are out there. Distract people by telling them, hey, the trust fund is stolen. It's not stolen. I've talked about this many times. Please stop that internet myth. The trust fund is being given to illegals. No, if you're not in this country legally, you cannot get retirement or disability benefits. How do I know? I've adjudicated hundreds of thousands of those claims, and you have to put the citizenship and the alien status, the green card, in the application in order to adjudicate the claim. The fraud, waste, and abuse. Is there fraud, waste, and abuse? Absolutely. Is it going to save Social Security is it going to add more than a few days on Social Security? No. So fraud, waste, and abuse, yes, it needs to be addressed. And then whatever the internet myth is of the day. Now I think the internet myth of the day is all the Social Security money is given to Ukraine or something like that, whatever crazy thing is out there today. So ignore, distract people, and the ultimate goal is always follow the money, to privatize. So give Social Security the trillions of dollars over to Wall Street, like essentially we already have with Medicare Advantage. That's privatized Medicare. And so the ultimate goal is Social Security Advantage, or as some people call them, Medicare Disadvantage or Social Security Disadvantage. So there's some people out there that say, yes, the money should be given over to Wall Street and all the rest of it, and advocates of that, then I guess then you're well on your way. But for those of us who want Social Security to stay around here, it's been around here since 1935. We need to not ignore the problems, not ignore the solutions. We need to stop the distractions and get our politicians to actually do something. And that also includes journalists out there. Please ask the follow-up questions. If you don't touch Social Security, fine. You're not going to hurt it anymore. But what are you going to do to make sure those cuts do not happen in 2034 or 2031? It's not going to happen during the next president's administration. So he's good. It's going to happen during the next presidential administration, and that next president will be blamed for the cuts. This should have been done decades ago. I'm not blaming the next president or this president or the previous president. I'm blaming all of them, all of Congress for the past 20 or 30 years. We knew this was going to happen for 20 or 30 years, and we just keep kicking the can down the road, and the road is ending. So we need to do something. So, okay, there's my 15 cents. All right, let's get into some questions. And one of the things that Social Security, so we're talking about future cuts in a few years, but a lot of people don't realize there's cuts happening right now. That's another strategy, is to choke Social Security so much that they can't help you get the benefits you're entitled to. This is what I'm doing in my semi-retirement to make sure you're getting the benefits that you earned right now. There's too many people that can't get into Social Security. They can't get their questions answered. They can't file a claim. They don't know they can file a claim. And so those are people that are getting their benefits cut right now because Congress and the president refuses to provide those services to you, even though you paid for them. When you paid your FICA for all those decades, part of that was for your retirement or disability or survivor spouse benefits, but part of that, 1%, 1.2%, was supposed to go to help. When you reach that time, you were supposed to get help making sure you're doing the right thing. But you can't get that help, and that's what I'm doing here in my making these crazy videos, trying to help you all as much as possible. Okay, let's. I want to go through before I open it up for the questions out there. I see tons of questions. I want to answer a few things I've seen in YouTube comments that people are making mistakes. There's a lot of people out there that don't know that there is a program called Disabled Widows Benefits. So Disabled Widows Benefits, you can file for benefits on your own record for disability, but widows who have married someone and they passed away, and if they're disabled, they can get benefits on that person's record from the age of 50 to 59. Once you turn 60, then you can go ahead and get regular surviving spouse benefits, and it's not based on disability. But between the ages of 50 and 59, please share. There's a program out there called Disabled Widows Benefits. All right, next mistake people are making is a lot of people don't realize that in terms of divorced spouse benefits, you need 10 years. You need to be married to that person for 10 years for divorced spouse benefits. But as everything with Social Security and pretty much the government, there's an exception to the exception to the exception. In this particular case, 10 years is not necessarily consecutive. 5% of people out there remarry the same person. And they say, wow, I guess that person wasn't as bad as I thought it person was. So if you were married to a person for 5 years and you remarried, but you had to be remarried by the end of the next calendar year, if you remarried the same person by the end of the next calendar year and then were married for another 5 years to that same person, then Social Security can add those two times together to come up with the 10 years. Another thing a lot of people are missing out there is, particularly in this season, they're not being told about the Medigap option. A lot of insurance brokers, agents out there are only telling people about Medicare Advantage because they make more money on it. The insurance companies make more money. But there are other plans out there called Medicare supplement plans. N, G, old one used to be called F. There's other ones, but most people get an N or a G. So if you're new to Medicare, you just turned 65, or you stopped working and stopped receiving health insurance from work, and you're signing up for Part B, please check out Medicare supplements first, the N and the G. And if it's not right for you, then go down to a Medicare Advantage and see about that. Another thing, I just got an email today that someone was told something wrong at the Social Security Administration. So hearing someone at the Social Security Administration at one of the windows telling you something is not an official decision. This person went in there and I told them they could file for voluntary delayed retirement credits. before you turn your full retirement age, you can suspend your benefits to get those extra delayed retirement credits. And she went in there and the person said, no, you can't. You can't do that. You have to withdraw your application, pay all your money back. I responded, I gave her the reference, and yeah. So if I hadn't provided that, then they would have just taken that person's statements. Person at the front window. That is not a decision. So you have to get an official decision. How do you get an official decision? You apply for the particular program, and then you get the actual letter, and then you can appeal that decision. But it has to be an official decision in order to appeal it. Okay. All right. So let's go ahead and answer all of your questions. Let's see how many I can get to. Let's see, Sherry, tax. It looks like Barry's answering someone else's question. Okay, about IRS. Yes, I stay away from IRS questions because I never work for the IRS, and so I try to stay in my lane. Unlike a lot of people in social media out there that try to answer Social Security questions that don't have experience. But anyway, I won't talk about that today. Let's see. Filed in 2011 at 62. Told rep I wanted to suspend my benefits until age 70. Oh, there we go. And draw on X's. Told me no such thing, so filed on X. Was this true? If not, can I get retroactive dollars now, age 75? Okay. So it really depends. The law changed in 2016, so I'm not sure whether you were grandfathered in the previous law. But as of right now, just as I was talking about the person that was looking for to suspend their benefits, it's called voluntary delayed retirement credits. And I'll put it actually, I'll put the reference in the chat at the bottom there. But you can actually suspend your benefits once you get close to your full retirement age and then restart it at 70 years old and get that 8% delayed retirement. So it adds 24% onto your benefit amount. But in terms of stopping yours and going to file for a spouse, the only time you can do it now is if your ex-spouse is deceased. You can only do it surviving spouse benefits. But right, the 2016 law said you can't do it if that person is still out there alive and kicking. But prior to 2016, you could. But regardless, in your particular case, I wouldn't. I would try it. Again, I don't know the specifics of when you do it and whether they're going to grandfather you in. And it's frankly their job to determine whether they can grandfather you in on the previous one based on protective filing when you did it. So I would do it. I would try it. Hey, it doesn't hurt. You file an SSA 561. It's a request for a reconsideration. And there's only a very small block there where you can write what what you want to appeal. So type up another piece of paper and say, hey, I called this and I did this at this particular time and this particular time, but here's what I wanted to do. And I believe y'all made a wrong decision and I want my back pay. And then on the front of the form, you just put see attached, give it to them, make sure you make copies of it, have them initial it and stamp it that they actually received it, and then come back here and tell us what happened. Let's see. I got a call from a company. I try to avoid company names, stating that Medicare Part B is now offering 3 new tests for neurological, physical, and bone. Is this legit? Not sure. It sounds possibly like a Medicare Advantage plan. Um, but if it's coming directly from, and if that's your health insurance, that's who you have your Medicare with, and it's an actual thing, I would probably call your doctor and say, hey, I heard that, there's these new tests available. And so if I come into your office and get that test, is my insurance going to cover it? So I would do it that way. Yeah, doesn't hurt to check. And then it's the end of the Medicare season, but remember my team there at Chapter, they help with all things Medicare, Medicare supplements, Medicare Advantage, Part D plan. So if you need help on that, make sure you reach out to them and they can help you out. And one of the great things why I chose them to partner with is they have a member success team. So if Carol, if you are part of Chapter there, if you enrolled with them, remember you have that awesome member success team, and they help with these type of things, prior authorizations, finding a new doctor and stuff like that. That's exactly why I partnered with them, because they have that. Do you have to call a month in advance to suspend your Social Security if you haven't started taking it? Okay, so if you just filed and you want to suspend, so you can do the suspense, just before you reach your full retirement age. Um, if you want to just stop your benefits, if you just filed and you haven't received any checks, well, actually, within 12 months, you can do a withdrawal of your application. So within the first 12 months, if you change your mind, go back to work, whatever, and you don't want your Social Security benefits, you want to wait till later, you can withdraw the application. And so they withdraw it. It's like it never happened. Because it never happened, you have to pay back all the money. So that's within the first 12 months, if that's what you're talking about. If you're talking about suspending it before you hit your full retirement age, yeah, about a month or two before you do that. And then the other way to suspend your benefits is, because you go back to work. So if you go back to work and, you start making $100,000 or so, you call up Social Security and say, hey, I'm going to be over, the annual earnings limit for next year, which is what, $23,400. So if you go over that limit, then if you go way over that limit, it's definitely a good idea to call them up and get your benefits stopped, so you don't get that one of those ugly overpayments next year. Hey Ed, how you doing? Hey Wanda, how you doing? Still working on the petition. Should have it here in the next week or so. But how am I doing? Every day above ground is a beautiful day. Everybody gets an F interviewing that individual. Always get it. Yeah, thank you very much. Yeah, I'm actually my final exams in my university class start today. So yeah, I'm going to be grading exams for the next week. So it's a beautiful thing. You better not cut my check. I'm living on 1,300 hours a month, and that's even $1,300 a month. Okay, Kathy. Yeah, if you're living on only $1,300 a month, please make sure you watch my video I did about a week ago. It's in the live. And about a week ago, it says living on Social Security alone. And I talked about 50 different programs that might help you out, make your life a little bit easier. The Medicare Savings Program, Department of the Aging, all 50 different programs. So please, please, please watch that out. Watch that video and see if it makes your life a little bit easier. So, if definitely number one thing, if you're receiving Medicare, please call Department of Social Services or Medicaid or Department of Welfare in your state and apply for Medicaid. And if you get that, and they just might pay for your Part B premium, and that'll put an extra $185 into your pocket. And then there's other benefits out there, those grocery cards that you see advertised all the time that they do a terrible time. It's kind of a scammy way they advertise it, but those cards are available. So I reached full retirement age in August 2025. If I collect Social Security benefits in March and continue to work until December 2025, will I be penalized? Okay, so for next year, so your full retirement age in August. Starting in August, you can make $1 billion a month, and it doesn't affect your Social Security check negatively at all. But prior to that, between January and July, you can make up to $62,000. So the year you turn your full retirement age, it's no longer, the $23,400. It's for next year, it's $62,160. And anything over that, Social Security holds back $1 for every $3 you go over. Normally, it's $1 for every $2 you go over. So as long as you're going to be under that, you're good. You can collect benefits. Until start your benefits in January. If you want to start it early, work might not be an issue for you. Barbara, 64 on survivors, but qualify for IEDS. Does this stop my benefit from growing if I change? So the IEDS, independently entitled divorce spouse benefits. So that is from another spouse. With the independently entitled divorce spouse benefits, those are spouse benefits for someone, your ex is currently living. So that means you can only get up to 50%. If you're receiving survivor benefits, you're getting up to 100% of that person's benefit. So I would definitely check out the numbers. I would call Social Security and say, hey, you can see I'm getting X amount of money right now, but one of my other exes just turned at least 62, and I might be entitled to benefits on that person's record. How much is there? And if it's more, then you just might want to switch. But because it's independently entitled divorce spouse benefits, and that person is still living, you have to file for benefits on your own record first. With survivor benefits, you don't. So right now, you're receiving survivor benefits, and you hopefully didn't touch your own, and your own benefits will increase until 70 years old. But if you switch to independently entitled divorce spouse benefits, you have to start your benefits on your own record. So there we go. It's all way too confusing, isn't it? And again, this is the stuff that Social Security Administration is supposed to be providing out there and helping you, and sitting down with you and go over all your options. And they just don't have enough staff or time, or they're limited to how much of behind the scenes strategies that they should let you know about. So, but I am no longer an employee, so I can tell you what the hell I want. So anyway, and ex-Marine Corps sergeant, so you get the unvarnished. I have an Advantage plan, A and B, but do I have to have B? Yes. I want plan N. Good job. But I don't want to keep paying out money. Yeah. Well, to have a Medicare Advantage plan, to have a Medicare Supplement plan G, N, F, whatever, you have to have Part A and Part B. So, yeah. The only way you can get out of paying Part B is to have someone else pay it for you. That would be, Medicaid out of your state, or Medicare Advantage. They have these Part B give back plans where they pay part of your Part B, $50, $100, all of it, depending on one's available in your particular area. And you can call a chapter and they can see what's available in your area. I called the local senator and told how I feel, so I'm waiting to hear back from him. Awesome, good deal. That's what we need to. Yeah, anytime y'all have a problem with your local office or something like that, call them up. Or here's one way, I think, because these politicians won't do anything nationally. I think a trick that we could do is you call them up and say, "Hey, Senator, House Representative, Congressperson, the office, the Social Security office right down the street from you. Have you driven by there at 9 o'clock in the morning? And the line is way out there." Now it's not, because they can only do appointments now, which is the worst idea. It makes everything far worse. But hey, how come we have to wait on the phones for 3 hours and they get hung up on? Why do I have to wait for a month or 2 months for an appointment? Okay, forget the rest of the country, Senator, my politician, my representative. What are you doing to improve the customer service in that office right in your district? That's what we should be doing. And if everybody did that, then guess what? The little grassroots campaign. He has, of course, he has nothing to lose. Yeah, oh, yes, here's a good one. There's a lot of pages using Social Security cuts as clickbait. Beware. Yes, absolutely. And there's a lot of stuff out there. There's some, I get on my Google feed all the time, some newspaper. I don't think it's a real newspaper. I think it's out of India. India has newspapers, but it's directed to Americans. It's just kind of 100% clickbait. But yeah, I think the kind of the NBC, Meet the Press, Comcast, corporate overlords who don't want to have to pay FICA tax like the rest of us schmoes. They maybe told her, "Hey, don't ask a follow-up question. Don't ask, what are you going to do with that that guy that's beat up in the alley? Just, are you going to beat him up anymore? No? Okay, all right. Then nothing to see here. Move along." Can able account contributions be used for housing real estate investment? I don't think so. No. So an able account is a great thing. So if you're on a means tested program, SSI, Medicaid, or anything like that, and the idea is, okay, you're on these programs, you're disabled. Let's say you're in a wheelchair, and you want to get a wheelchair accessible van. You want to save up for a van so you can drive yourself and stuff. But if you take a little bit of money, people that give you some money, or you work a little bit and you put some money away, and then once it becomes $2,000 or $3,000, you're no longer eligible for Medicaid or SSI because you have too many resources. And you're like, but I want to use those resources for something good to make my life better. So you put it in an ABLE account. Depends on your age. I don't know why they have a limitation on age, but they just raised it. But it should be a lot more. But you can put it in this ABLE account, ABLE. Please check it out. And that is not affected. That does not, the money in there, you could have $10,000, $20,000, and that won't kick you out of Medicaid or SSI. So please check that out. So, let's see. Have you reached out to President Trump? Yes, I've reached out to Doge and all those guys. So, yeah, I mean, yeah, is Social Security, it could be more efficient. Yes, I could find several hundreds of millions of dollars to fix. Social Security employees and the rest of them wouldn't like it, but hey, it is what it is. But that's that's not even a drop in a bucket for what needs to be done. People say, oh, Ed can find $100 million, can save $100 million of Social Security. Yeah, pretty easy. But that's not going to help because we're talking billions, trillions. So yeah. Let's see. Please, yes, please call your senators, congresswomen, people. Yes, yes, please. And again, I'm not just saying this stuff out of pop of my head. I put all the references in the description below of why it's going to be 21% or 33%, and all the rest of it. So. Thomas, I just got approved for SSDI. I have a 15-year-old. Does he get any benefits? Also, does my wife qualify for benefits? She doesn't work. Thanks, Ed. All right. Hey, Thomas. Yes, if you just got approved for SSDI, then on your original application, you probably listed your child on there. So the Social Security offices should be reaching out to you to take that other claim for your child. However, they often drop the ball on that, unfortunately. So it's incumbent upon you to do it. So reach out to them and say, hey, I got my money started, this month and next month, but now we need to go ahead and take a claim for my child. So you'll take the claim, and the child will receive benefits up to 50% of your benefit amount until they reach 18 years old. And then when they reach 18 years old, if they're still in high school, let me check my microphone here. If they're still in high school, then they'll continue to get benefits until they graduate high school, or 19 in a couple of months. In terms of your wife doesn't work. If she's home taking care of the child and the child is under 16 years old, yes, she can get benefits. It's called auxiliary child in care benefit. So make sure she'll get up to 50% as well. Why do I say up to? There's a family max involved. There's a maximum that can be paid on at a particular record. So, and they'll tell you exactly what your family max is on your particular record. So, yep, definitely file. If your child is, so her benefits will stop when your child turns 16 years old. If your child became disabled before the age of 22, then her benefits can continue because she's taking care of a disabled child. But hopefully that's not the case, and her benefits will unfortunately stop at 16, but his will continue. As in the past, we will not know what will happen with Social Security because consider it an entitlement, and they will do anything or kick the can. Yeah, I get a lot of people when I use the word entitlement and all that kind of stuff and benefits, and they say it's not an entitlement. I paid for it. It's You look in the dictionary, pull up your old Merriam-Webster's dictionary and look at the word entitlement in the dictionary. There's the four-letter word of entitlement. Oh my gosh, it's entitlement. The old Reagan, welfare Cadillac, all that stuff. That's the four-letter definition of entitlement. But if you look at it, there's also a legal insurance type of definition of entitlement. And these are entitlements. You're entitled to them. You paid for them, and therefore you're entitled to them. If you fill all the requirements, if you paid into retirement all those years, and you're entitled to it if you're 62 years old and, you're not in jail, or you haven't been kicked out of the country and lost your citizenship and stuff like that, you're entitled to it. So yeah, again, that's part of the word games that people play are part of the distraction. That's the distract part. The trust fund has been stolen. No, the trust fund is still there. It's going to be running out in 2031 or 2034. It was specifically for the baby boomers, but they didn't plan on the low birth rate, and they really didn't plan on how many people are not paying Social Security FICA tax because of the cap there. So yeah, all the internet myths about terminology, we're just fighting about terminology, and divide and conquer. I guess I should add that up there. Divide and conquer us and make us do the whole wrestling match about conservative and liberals and Democrats and Republicans, and yeah, all political parties have failed us. And yeah, so that's why we're in the position we are with Social Security, that we need to do something. Okay. Is a rental income considered income when I collect my Social Security? I'm 63 and 67 is my retirement age. No. Um, if you're just, you just have a, one or two, but if your business, you have a business that, you're a realtor and stuff, and your business is renting out places, then that's kind of a business and that's part of your net income, then it would be. But if you just have, Airbnb or, just a, one or two or something like that, no, it's not considered work. It's kind of it's kind of your 401k, right? So it was to help you with retirement. I was shocked at how little time they spent on this part of the interview. Yeah, I was shocked too. And I was like, she asked, are you going to cut Social Security? People are worrying about their Social Security and Medicare being cut. And he says, no, I'm not going to do it. I'm not going to raise the retirement age. I'm not going to cut it. And then she turns the page and I'm like, oh, yeah, the next page has the follow up questions. Here's the meat of it. And the next page just goes on to another subject. It's wow. It just, come on. She do better than that. Tim Russert is, would be rolling over in his grave. Yeah. Just got approved for, okay, I already answered that one. Yes, please click like and subscribe and share and all that kind of stuff. This is how this teaches these algorithms that this is important stuff and people need help and we need to save Social Security and make sure people are getting the benefits they're entitled to. And how can we do that is you press those little buttons. So I appreciate it. Cut other things, not Social Security. Yeah, yeah, there's a lot of other things that need to be cut out there. I'm an old ex Marine Corps sergeant, and we spend way, way, way too much to the Department of Defense. You talk about fraud, waste, and abuse. Yeah, Social Security has nothing on the Department of Defense for fraud, waste, and abuse. So I like that he said he's going to attack the inefficiencies. Yeah, yeah. There's nothing wrong with attacking the inefficiencies, but that's less than a penny per dollar of what we need, so it's very, yeah. Please listen to what Ed is saying. This is not hyperbole. We all must call our senators and congressperson. Yes, please. Yes, please reach out. That's the only thing. Participatory democracy. Hi, my friend on SSDI bought some XRP and is making yeah, I have no idea. Is that one of these Bitcoin type thingies? I'm 64 as of 11/20/29 or 11/29. I have been swarmed by calls to help me set up my burial cremation services from Senior Services. I may have messed up the verbiage, but can you explain this? Yeah, if it's you get a bunch of calls, it sounds like it's one of those final expense burial insurance sales people type things. Um, Maybe something along those lines. Senior Services. Yeah, that sounds like it's some insurance company and stuff. And one of the tricks that they do, burial insurance and having money, if you don't have some money in the bank to take care of your burial and everything like that, it's very good to get, some type of term or burial insurance or something like that. I'm not against that. I've been trying to find a company that will help y'all do that, but there's just so many in that particular industry, of the final expense burial insurance, or they're just very super hard salesperson, and they're just way, way too pushy. And I haven't found anybody good yet. But one of the things that they use is they advertise those things and they call, hey, there's this new thing available in your state. It's a state sponsored or approved burial thingy. And you call them up or you reply, and because it's state whatever, it's state supported, and you think it's that it's from your state, um, and they're just playing around with the verbiage, because all insurance is regulated by the state. Your car insurance is regulated by the state. There's the Department of Insurance in every single state, and they're the ones that regulate life insurance and burial insurance and car insurance and Medicare plans and all the rest of it. Medicare supplement plans, not Medicare Advantage. So they regulate all of those people. So when they tell you that, hey, this is a state thingy, no, it's not. All insurance is state thingy. So they kind of play around with the terminology there. So, but yeah, the Social Security Administration, I've given out hundreds of thousands of these lump sum death benefit when you pass away. Social Security Administration gives you $255. It's been the same amount for decades and decades. It's pathetic. So yeah, $255 is definitely not going to get you a burial. Maybe a few flowers tops. So, you would be required. Okay, Penelope is always here answering questions, and she's always been 100% right. I think she used to work for Social Security Administration, but yeah, so she's doing very, very well. So. Let's see. I know you will pay Social Security even when you died, that's going to stop for elderly people. So survivor benefits type stuff. Yeah, hopefully they don't get rid of survivor benefits. You know, there was a bunch of clickbait going out about spouse benefits stopping, and that was just clickbait. There are study committees, politicians talking about ending spouse benefits, but as of right now, spouse benefits are still good. What it was is that 2016 law I was talking about, that 2016 law stopped a particular strategy of receiving spouse benefits, and that ended. So the strategy was the spouse files, and then they suspend so the other spouse can get benefits. You can't do that now. You have to file on your own record, and you can't suspend. If you suspend, the other benefits stop too. So it was just a strategy that ended. So people said, "Hey, spouses can't get benefits anymore." So yeah, so much clickbait out there. I have a question. I turned 65, got Medicare, still working, then laid off 4 months later, filed unemployment and had surgery, cannot work for disability. I've heard nothing back. Um, yeah, so if you're 65, you got Medicare, you're still working, but then you're laid off. So when you're 65, you always hear that Medicare is mandatory. Yes, unless you are working and you have health insurance from current work, yours or your spouse's current work, and your employer has 20 or more employees. If that's the case, you do not have to sign up for, Part B, save yourself the $185. If that's not the case and you don't sign up for Part B, the one that covers the doctors, or Part D, what covers, the prescriptions, then you're going to get penalized. You get penalized for the rest of your life if you don't sign up for it at the right time. But in your particular case, you stopped and started. And so, in terms of Medicare, there is a special enrollment period. So if you have health insurance from work, yours or your spouse's, 20 or more employees, and you don't sign up for Part B, no problem. And then 5 years later, 10 years later, 20 years later, you sign up. Then you just have to prove that you did have health insurance from work. It's just a simple form that you take down to your HR. They fill it out, and super, super easy. And then you start Part B at 70, 75, 80, 95, and there's no penalty whatsoever. In your particular case, sounds like you want it, and then you stopped it, and then, yeah, possibly looking to restart your Medicare, yeah, reach out to a chapter there. They work the entire country, and they can check and see what status you are and if you can get restarted. I haven't heard that Medicare is going to be cut. Yeah, it's the Part B is good. Part B is solvent and good forever because Part B, they determine how much Medicare Part B is supported by the monthly premiums. So everybody pays $185 and that pays into Part B. So Part B is good. That covers your doctor. That's good. Part A, that's the one that, yeah. So we're looking at Part A has issues going forward too. So that has to be addressed. And then, as everybody knows, the Medicare Advantage, the new head of Medicare, Center for Medicare and Medicaid Services, Dr. Oz, if he's confirmed. He has always been an advocate of Medicare Advantage plan, which is essentially privatized Medicare. But I also heard because the problem with Medicare Advantage is prior authorizations, which I'm sure you've heard in the news recently, and the networks, the continuing decline of these networks. Less and less doctors and hospitals and clinics are taking them. But Dr. Oz, I guess, is against prior authorization. So I don't know. So we'll see. I'm going to keep an eye on Dr. Oz and the new commissioner of Social Security and make sure, they do what we want to do rather than, I guess the people that write their checks, right? I guess we write their checks. But anyway, Irma question. 2025 is year 2 on Medicare. Because of the 2-year look back, I have an Irma by 2025. My appeal last year was approved and I appealed this year. Do I pay the increased amount or 185? I would go ahead and pay the increased amount until your Irma appeal, which is, you filed the SSA 44, uh, because if it was approved last time, it's the same situation. I'm sure it will be approved this time, but I would hate to see you not paying the extra and then they cancel your Part B and then becomes a whole nightmare in your Part D. And yeah, you don't want that. So I would just go ahead and pay it. And if they approve it, then they'll pay you that money back that you paid over. So I understand you probably want that money now, but yeah, I wouldn't risk it. Just go ahead and pay it up. So I'm jumping around. I have tons of questions here, and we've only got about 15 minutes left. So I'm going to jump around here and try to find people I've never seen before here. My name is Christina. My husband passed away on May 24th, and I'm trying to collect my survivor benefits, but was told I couldn't. I turned 65 years. Yeah, you couldn't. The only reason would be, you have to be married to someone for at least 9 months, unless they pass away by accident or military service. But if you were married to that person for 9 months, it wasn't a divorce, but actually married to that person. And if you're currently receiving benefits and your benefits are higher than survivor benefits, you can, but that's a lower benefit amount. So that's the issue. So Social Security always tries to pay the higher benefit amount. The only thing that you could possibly do is once you get close to your full retirement age, if you're currently receiving benefits on your own record, you get close to your full retirement age, you can suspend, voluntary delay your benefits on your own record, get that 8% increase every year, and then switch over to survivor benefits. And it sounds like possibly your survivor benefits are less, but you're looking for the long term. So that would be the only way. They would deny you for survivor benefits, or if you just didn't provide documents. Sometimes people say, "Hey, I was just denied," and simply because you filed the application and you didn't provide the documentation in time, so they just closed it out. They didn't really deny you. They just said, "Hey, you didn't provide the documentation, so you're denied." And then you provide the documentation, they reopen it. So I've done that a few 100,000 times, so it's not a big issue. All right. In 2022, the U.S. gave 6.2 trillion in foreign aid. Take 5 trillion out of the general fund and problem solve. Yeah, I mean that is a solution, to take it out of the general fund. But I prefer, because Social Security has always been separate. Social Security does not add one dime to the deficit because it's funded separately. And people are gonna look it up. um, but it's funded separately, and I think Social Security should, be as the same it's been since 1935, not taking donations from, because we already got $36 trillion in debt in the general fund. I say we have to address that separately. But in terms of Social Security, there's easy fix. Again, look at the actuary report in the description, and it'll take you all of 10 minutes to come up with a solution to solve Social Security, to where you're not going to get cuts, your kids won't get cuts, your grandchildren won't get cuts. You'll be good for 75 years and plus. It'll take you 10 minutes to fix. Why don't we do it? Is because our politicians perhaps don't want to fix it. And I'm talking both sides here. If it could have been fixed many, many, many times over the last 3 or 4 decades, but why hasn't it? I guess it's the conspiracy theorist. I'm not a conspiracy theorist, but yeah, I'm beginning to wonder. Betty, thank you very much for the support. $5. All right, thank you very much. Got my coffee IV for the day. Kim, they say at 67, I get only half of my benefit, but will get full benefits at 70. Has that changed? So what you're talking about, so you will get half of your benefit. No, at 67, you get your full benefit. At 70, you get your full benefit plus 24% because you get the 8% added. The half thing, you're probably talking about spouse benefits. Yes. At your full retirement age, you're entitled, if you were married to the person long enough and all that, to up to 50%. Well, at full retirement age, you're entitled to 50% of a spouse's benefit amount, minus your own. If that person passes away, then you're entitled to 100%. So let's see. Do we get taxed on our Social Security payments? It really depends. About 40 or 50% of people don't get taxed on Social Security because that's all they make. Unfortunately, that's sad in and of itself. But if you make over $25,000 to $34,000, 50% of your Social Security benefits can be taxed. If you're making over that, 85% of your benefits can be taxed. Not 85% tax rate, but 85% is subject to taxation. And that's something that the next president is talking about, ending the taxes on Social Security benefits. Which, okay, I'm kind of good with that. It should have never been taxed. But number one, that's one of the reasons why the trust fund is going to depleted sooner and be cut more, because that's billions of dollars. That money goes into the Social Security trust fund from those taxes. And it's not going to hurt the people that it really needs to help, is the low, people that are just living on Social Security who don't pay taxes anyway on their Social Security benefits. That's not going to help them, but it's going to cut their benefits sooner. So journalists have learned that they can't ask Trump any follow-up questions. He'll just call them nasty, and so yeah, but I watched the whole interview, and some of the other questions had follow-up. I mean, just follow-up, it's just like, okay, all right, good, perfect. You're not going to beat this person up anymore. You're not going to cut benefits, or you're not going to raise the retirement age, but cuts are going to happen here pretty soon. What are you going to do? And, drill, baby, drill does not do it. What law says the government can't pay Social Security benefits out of the general fund? I'm not sure if there's actual law, but it's never happened since 1935. It's a pay-as-you-go system. I think there is a provision in there, but Congress can always change the law. They make the laws, they can change it. But again, we've got $36 trillion of debt on the other side. So I think Social Security just do a super easy fix. Which company has a Part D with a fair premium and copay, especially on antibiotics? It really depends. Whenever you're looking for a Medicare supplement plan, Medicare Advantage plan, Part D plan, don't take anybody else's recommendations. They are all specific to your particular needs and your particular area. If you've got someone in Homestead, Florida that has, really similar to you, but in their area, this one is the best one. You're in Portland, Oregon, you're very similar twins, but another plan is the best one. So it really depends on your particular needs, your particular area. So that's why it's important to really do good research. And that's why partnered up with Chapter, and they can help you do that. Well, let's see here. My understanding is that many illegals use someone else's Social Security number. So yes, if they don't pay Social Security, the fund will run out faster. Yeah, that's another thing. If yes, people that are not in this country legally, there's a bunch of them that get a fake Social Security number, or they had a valid Social Security number and then their visa ran out. We got a lot of students come over here to go to college and get a Social Security number to work part-time at the library or something. But then they stay and they pay into Social Security, but because they're not in the country legally, when they go to file for retirement or disability or something, they don't get it. So that's basically, it's estimated at about $37 billion goes into the Social Security Trust Fund as a donation for those people that aren't here legally. So if we get rid of those, that's $37 billion. So that's going to cut the more cuts in the future. So let's see. How can I find out mine and my spouse's PIA? Perfect question. Yes, I see a lot of people making this mistake. Again, if you are looking for spouse benefits, your spouse their benefit amount has to be twice your benefit amount for you to be entitled to benefits on their record. Okay. And what people often look at is they look at the MBA, the monthly benefit amount, the check. How much was deposited in your account? Okay. How much was deposited in your account? Okay. Well, your check is not twice as much as mine, so therefore I guess I can't get benefits. No, that's not the number you look at. That's called the MBA, the monthly benefit amount. You need, as points out, the PIA, the primary insurance amount. The primary insurance amount is the amount you would have received if you waited till your full retirement age. So those are the numbers you need to see if you're entitled to spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits, or whatever. How do you get that? You call up Social Security. That's pretty much the best way to do it. Call up Social Security and say, "Hey, I want to file for spouse benefits on this person's record," and they'll, get that person's social. If you don't know the social, just give them the name and date of birth and where they were born, and the employee will be able to find the social, and they'll say, "Yep, no, it's no more money there. Sorry, that one is not twice the other." And if there is, they'll say, "Oh, yep, there's more money there. Let's schedule an appointment." And you schedule the appointment, and you go get your money. Let's see here. Oh, I don't think I've seen Maine Bob here. I'm 74 and on Social Security with Advantage, and Medicare will not cover more than default single focus cataract lenses. Oh, yeah, the coverage. Yeah, out there in Maine, probably not a lot. It's Maine, right? Yeah, I guess Maine, Bob. Yeah, obviously. Yeah, some parts, and there's some parts of the country, and I know out west in the deserts and stuff, they don't even have any Medicare Advantage. Or there's one. I'm not going to mention the company. There's just one that offers a Medicare Advantage plan, and it's just terrible. I'm not going to mention the name, but yeah, there are some parts of the country that don't have a lot of competition. And what we saw for this Medicare season, this has been the most disruptive in decades because close to 1.8 million people have had their Medicare Advantage or Part D plans canceled. So if you received a letter that said you're canceled, then it was better to to find a new plan December 7th, but you still have time to do it. It depends on the letter, your area and stuff like that. Sometimes it gives you a little bit of time. So I would definitely, make sure you find a new plan sooner rather than later. And there's a lot of, I know this is a fact. In January, there's going to be a lot of people coming in here and says, "Hey, I just went to the doctor and I had this procedure and it costs, $400, and they, charged me, $100 for it. Why? I never had to pay 100. I showed them my card and they said it was canceled." Yeah, you didn't get the mail. The mail was lost in the mail. You didn't open the letter that says your plan was canceled, and you didn't find a new plan in time. So unfortunately, if you know anybody, make sure they, reach out to their insurance agent or broker, or call Medicare, or call the company directly, or reach out to chapter, whoever, but, reach out to someone and confirm that, that you are going to be good for the next year. It doesn't hurt. I know there's going to a lot of people that are going to be very, very surprised in January. It's a crazy year, and it's going to be even crazier going forward. But I'll be here. Kat, I'm 62 on SSDI and SSI. My ex retired at 64. As Social Security made an appointment for me to go over what my benefit would be. Can I be forced to take it if it'd be less? I make less than 1,000. Because you mentioned SSI, yes. If you're on SSI, it probably won't be less. So if you get, if you're getting, because on SSI you get $943 max, so you're getting 943. So if benefits on your ex's record is $942, you'll get that, plus you'll get an extra dollar from SSI. But unfortunately, what might happen, well, maybe it depends. It depends on how much your benefit amount is from your ex-spouse. But if it's over the SSI limit, then you might have some issues, because if you lose SSI because you make more on the spouse record, if you've got Medicaid, you might lose Medicaid. But it really depends on your particular state, and what level of Medicaid they have in your particular state. So, but yes, because you're on SSI, they can require you, force you, mandate you to file for any benefits you're entitled to, because SSI, Supplemental Security Income, the welfare-based program that Social Security administers, that does come out of the general revenue taxes. And because it's a welfare-based program, and anytime you receive a welfare-based program, there are certain things you have to fulfill. Every year, SSDI part comes out of the regular Social Security Disability Trust Fund and all that kind of stuff. So, yeah, it's kind of crazy. Let's see here. I would never volunteer to take any insurance offered test. That's like data mining. They are pre-screened for people who are going to cost money in the future. You will be flagged to a watch list. Yeah, the was it John Oliver last week tonight? Yeah. He did a great one on data brokers about a month or two ago. Check it out on YouTube. I used one of his videos one time on what was I called it hospice, and I guess I used too much of it, and yeah, YouTube flagged me and pulled my video and stuff. And come on, John Oliver, let me use your videos. Come on, so if somebody knows John Oliver, HBO, give me authorization to use your videos. They're awesome. But yeah, check out his video on data mining. That's how, or data brokers. That's how, when you turn 65, you ever notice when you turn 65, you're now the most popular person in the country. Everybody wants to take you to the turning 65 Medicare prom. You're the new homecoming queen or king. Because when you turn 65, if they enroll you in a Medicare Advantage plan, they make twice as much money as they do any other time. So that's why. And how do they know? Data mining, data brokers. Anytime you press a button on Google or something like that, it goes in the data brokers, and the data brokers sell that information to Medicare insurance agents and brokers and companies. And they say, hey, Joe in Topeka, Kansas is turning 65 next month. And everybody descends on you and calls you and harasses you and all this. Yeah. So, yeah. Anyway, that interview sucks. It was an F. Yeah. All right. So you're not one of the corporate overlords, Wanda. If you were, you would have gave her an A plus. So there's that. All right. We are over an hour. That is it for today. And I apologize. I have tons of questions here. I will be back again tomorrow. So please cut and paste your question. Join me tomorrow, and I'll get to as many as I possibly can tomorrow. Y'all have a great day. Please look out for each other, and we'll see you next time.